Good morning, my name's Adam. I'm going to be your name nurse today. What would you prefer to be called?
Hi nurse, my name is Patrick.
Hi Patrick. I understand from my colleague you're not feeling too well. How are you feeling?
I feel terrible. I don't know what's wrong. I'm getting very worried now.
Okay. I'd like to do an ABCD assessment to see if we can figure out what's going on and see if we can start to make you feel a little bit better. Do I have your consent to do so?
Yeah.
Okay.
I think to make me feel better.
Lovely. Okay. I'm now going to start my A for airway assessment. Patrick is speaking to me, so I'm happy his airway is patent and he is free from obstruction. I'm now going to assess B for breathing. Patrick, I'm just going to assess your respiratory rate and put a monitor on your finger just to check your oxygenation levels.
It's okay.
Thank you. Patrick's respiratory rate is 29 and his oxygenation saturations are 88% on room air. I'm now going to assess his work of breathing. Patrick, I'm just going to assess your work of breathing. Is it all right if I put my hands on your chest?
It's okay.
Thank you. Patrick has equal bilateral chest expansion, but his breathing is shallow and he's speaking in broken sentences. So I'm going to put 15 litres of oxygen via a normally breathed mask on him and get him to sit up as well. Patrick, I'm just going to give you some oxygen via a face mask. Is it okay if I do that? Do I have your consent?
It's okay. Yeah.
Okay, lovely. And we also need to get you to sit up a bit if that's okay.
Yeah, sure.
Are you comfortable?
Yeah.
Okay, let's put this on. Okay. I'm going to leave a saturation probe on so I can continuously monitor his oxygenation levels to see if they improve. I'm now going to check C for circulation. Patrick, I'm going to check your circulation, so I will be checking your pulse, your blood pressure and a capillary refill time, which will involve me pressing on your chest for 5 seconds. Do I have your consent to do so?
Yes.
And is it all right if I use this arm for your blood pressure?
Yes.
Okay. Okay. I'm just going to expose you ever so slightly. Thank you. 1, 2, 3, 4, 5. Okay. Patrick's heart rate was 128 beats per minute. It was regular but quite weak and thready radially. He's also quite cool and clammy to touch. His capillary refill time was 3 seconds. I'm now going to check his blood pressure. Thank you. So just relax your arm there. Patrick's blood pressure was 105/75, and I noticed earlier it was 140/85, so that's a drop. I'm going to ask my nursing assistant to come and assist me here. Patrick, your blood pressure was a little bit low and your heart rate was higher than that, so what I'd like to do is put a cannula in your arm, which is a little plastic needle. We'd like to take some bloods and take an ECG. Do I have your consent to do so?
Yes, that's okay. Yeah.
Okay. Dan, are you able to get me the stuff I need to cannulate my patient and take bloods as well as get the ECG machine for me, please?
Yes, Adam, I can do that straight away.
Thank you very much. I would like to move on for D for disability next. Patrick has been speaking to me and his eyes are open spontaneously, therefore I'm happy he scores an A on the AFPU score. I'm now going to assess his pupils and BM blood sugar. Patrick, I need to shine a light into your eyes and put a little needle into the end of your finger to get a little bit of blood so we can check your sugar levels. Do I have your consent to do that?
Yeah.
Okay. Shall I lighten your eyes first? His pupils are equal and reactive, and they're a size 4. Okay, Patrick, if I can have your arm, please. Okay, and we'll get a little bit of sample from your finger there. Okay. Okay, if you want to press that for me. Okay. Patrick's blood sugar is 5.9. I'm just going to go wash my hands. Patrick, I would just like to establish your level of pain, if you have any at the moment. So I'd like to use a scoring system where 0 is no pain and 4 is very severe pain. Where would you place yours at the moment?
0.
Okay. As Patrick's pain score is 0, I'd now like to move on to E for exposure. Okay, Patrick, I now need to do an exposure assessment. So I'm going to look at you from head to toe. Which means exposing you, looking at your chest, your abdomen and your legs, but will maintain privacy and dignity throughout. I also need to check your temperature. Do I have your consent to do so?
Yes.
Okay, we'll start with temperature. Let's just get it in your mouth there. Patrick's temperature is 36.2, which I'm happy with. I'm now going to go on to my head-to-toe assessment. So Patrick, I just need to expose your chest and your abdomen. And just tell me if you feel any pain at all. Okay. There's nothing else to note, so we'll cover you up. Just going to expose your legs. Okay, any pain at all down here at all?
Okay.
Any pain?
Okay.
Okay. Patrick, I also need to have a look at your back. Are you able to roll onto your left-hand side for me, please?
Yeah, I think so.
Okay, that's absolutely fine. So I'm happy from my head-to-toe assessment of Patrick. There is nothing abnormal to note and his pressure areas are intact. Patrick, I've completed my A to E assessment and I've started you on some high flow oxygen. How are you feeling?
I feel a bit better. I still feel very breathless.
I'm a bit concerned about your blood pressure and your heart rate still. So while my colleague is going to come along and put a cannula in, take some bloods and do an ECG, I'm going to ring your doctor and ask for an urgent medical review.
Okay.
Hello doctor, my name is Adam. I'm a staff nurse on the observation ward and I'm calling about Patrick, who's in bed 2. I'm calling because he is acutely unwell and has a new score of 9. The patient was admitted with a temperature of an unknown cause on the 10th of November and the patient has no relevant past medical history. His condition has changed in the last 4 hours and he is now complaining of feeling unwell and difficulty in breathing. I've administered 15 litres of oxygen via a non-rebreathe mask and requested bloods, ECG and a cannula. His airway is clear, his breathing, his respiratory rate is 29 with SATs of 88% on room air. His circulation, his pulse is 128 beats per minute with a blood pressure of 105/75 and he's had no urine output over the last couple of hours. On disability, he is alert and his BM is 5.9. On exposure, his temperature was 36.2 with nothing else to note. I would like an immediate medical review. Thank you very much. Bye-bye. Okay, Patrick, I've just got off a phone from your doctor. He's going to come down immediately to have a look at you and reassess. Whilst I'm waiting for him, I'm going to reassess you as well using that same ABCDE approach.
Thank you.